So number one potential problem would be, is this basically a gateway drug for adolescents to really start experimenting at an earlier age with marijuana and certainly more potent drugs. And while the law limits recreational use of marijuana to people 21 years of age or older, obviously it would potentially increase access. And the initial data is that there's no evidence for that, meaning it doesn't appear that adolescents are experimenting with marijuana at an early age or have displayed any more addictive tendencies. So that somewhat is reassuring. The second area that I think is a little bit more problematic is that there's been a proliferation of edible products which contain marijuana derivatives. And this is interesting because, number one, this is nothing that is regulated by a federal agency such as the Food and Drug Administration. And number two, say in contrast to a medication where drug companies go to exorbitant lengths to understand how medicines are absorbed in the body, when the peak effect occurs, how long it takes for the effect to dissipate, and that sort of thing. This is largely unknown for these marijuana incorporated products, meaning we don't know when, after ingesting these products, the marijuana would take effect, how long it would last, and that would certainly have an implication for, say, people who would ingest these and then get behind a wheel of a car or something like that, or be expected to report to work. And related to that is that a lot of these things are packaged in a very appealing way, such as in candy bars and brownies and throat lozenges and all sorts of formulations. And this obviously would be appealing to kids. And one of the things that they have seen is an uptick in calls to poison control centers about poison ingestion from marijuana exposure through these edible products. So I think we really have to be mindful as other states go this route as to how this should be regulated. And then finally, as you and I think have debated before, what is the effect on, just say, people smoking a joint and getting behind the wheel of a car? And I think it's a little bit too early to know. There is one report that suggests that recent marijuana exposure increases the risk of fatality in a motor vehicle crash, and Colorado actually has refined what they're defining as intoxication for marijuana, but I think it's a little bit too early to know the effect with respect to, say, vehicular problems and vehicular injuries.
Yeah. Doctor, real quick, because this is kind of interesting. If somebody, I've never heard of somebody smoking and then dying of an overdose while smoking a joint or a bong or something, but can you overdose and die if you have too many pot brownies?
That I don't know, and I think what they are seeing probably is that they're seeing young kids that probably have had exposure to this and probably display, the manifestations of marijuana exposure, which would probably be less so in an adult, but in a young person, the same dose or same exposure would have more pronounced effects. And I suspect that's what they're seeing, and they've seen increased admissions to emergency departments with kids that have had marijuana exposure. Yeah.
All right. But we can debate that all day long. Let's talk about this thing going on in Indiana, because they're finding out that drug users are taking prescription drugs and shooting them and transporting or transmitting diseases through the needles through prescription drugs.
Yes, well, this is a common practice, meaning one of the ways that individuals can misuse narcotics, even prescription narcotics, is to grind them up and inject them. And drug companies have tried to forestall that by coming up with formulations which make it difficult to do that, but nonetheless, this continues to be a problem. The story out of Indiana is that this has resulted in, if you will, a minor epidemic of HIV infection. This is from a small community in Indiana where they might see on the order of 5 HIV cases a year. Since the 1st of January this year, they've seen roughly 80 cases, and it's related to both this practice and sharing needles. And so the governor has declared a public health emergency, and they're trying to implement needle exchange programs to minimize needle exchange amongst drug users. So this is another controversy for Indiana, but really points to one of the collateral effects of the narcotic abuse problem we have in this country.
Yeah. What about, so it went from 5 to 80
That's the first of the year.
Yeah.
5 a year is a spike to roughly 80 since the first of the year.
Yeah. What about hepatitis B? Is that a problem with this outbreak?
Well, it's all kind of hepatitis, so hepatitis B and hepatitis C. And so and the issue about hepatitis is that by and large it exists longer outside the body than HIV. So if anything, it's more infectious in people that share needles. So if one user is HIV or hepatitis C infected, and they share with another user, probably, if anything, they're going to be more prone to transmitting hepatitis C. And again, a huge burden on the medical community to treat. It's a very expensive problem to treat, and it's disproportionate in minority populations and underserved communities and prison populations and that sort of thing. So this is a big issue.
Doctor, I can't help but link these two stories together. Medical marijuana and recreational marijuana, as bad as it may be, it's not as bad as the legalized prescription abuse going on with those drugs.
Oh, absolutely. I think they're orders of magnitude apart, and I think it gets to a lot of issues as how all this should be regulated. And I don't mean to imply that marijuana necessarily is a gateway to these other drugs, but I think the issue with the HIV and needle exchange and narcotic abuse is something that is becoming an epidemic in this country, as the statistics bear out.
Right, but they're using legal drugs. Now, they might have stolen them or gotten them illegally, but they're legal over-the-counter prescription drugs that are doing this damage in Indiana. And while marijuana might do some damage in Colorado, it's exponentially worse in Indiana than it is in Colorado, it seems like.
Well, it is exponentially worse, and I don't mean to in any way pick on Indiana, because this is a national
right. But just
problem. But absolutely, so this is we see it with misuse of narcotics and prescription drugs, and states are doing everything they can to minimize this. But it's, this continues to be an epidemic and something we have to be very mindful of.
Dr. Bradley Freeman, professor of surgery at Washington University. Thanks as always. Great job. Talk to you soon.
Have a great day.
8:30 here, Big 550 KTRS. If you misuse prescription drugs, right, you get a hepatitis and an HIV outbreak. If you misuse the marijuana in Colorado, you end up falling asleep and getting the munchies. Right? I mean, it just seems to me like one's legal and creating all sorts of damage. The other one's legal in Colorado, and people are fighting tooth and nail to keep it illegal, whereas it does a lot less damage in Colorado and in terms of the marijuana, as opposed to the prescription narcotics in Indiana. But it went from 5 a year to 80 in 3 months. Wow. 8:30 here, Big 550 KTRS. St. Louis Closet.